The purpose of this article is to review changes in the ability of the muscles to contract and support the spine in dancers with low back pain and instability. I will focus on 3 changes in the muscles which can produce instability and lead to low back pain, not only in dancers but in anyone with the spine. I will use these cookies to review the basic anatomy of the spine. One cookie represents a backbone or vertebra. Yummy. The creamy filling inside represents your disc. Your disc is filled with fluid and is nice and plump when you're young. This stack of lovely treats is your stable spine. Your stable spine gives you a lot of support. Along the spine are the local stabilizer muscles. This brown tape will represent those local stabilizers or deep core muscles, which provide stability. The black band, which is further away from the spine, are your global muscles. They produce movement. If there is too much of a contraction of those global muscles, for instance your erector spinae, it will produce compression on the spine. That disc, the creamy white filling, will be herniated. It can also cause shearing of the disc, both of which cause instability of your spine. Now, you have your local stabilizers, and let's say there's a party at the spine at 7 p.m. Stabilizers are ready to go, but when there's low back pain, those stabilizers are delayed. They have a delayed contraction, they're late for the party, and there's no support. No one's home. That produces instability in your spine. Now, there's a couple ways we can work to find our stable spine. Take 2 points from your breastbone to your belly button, and then you're going to move through the extremes of your low back spine in extension and flexion. Now move through those same positions in your upper spine, extension and flexion. If you move in between those 2 points and contract the deep muscles, you will have a contraction of your deep stabilizers and less instability in the spine. Now, people who have breathing difficulties like asthma or allergies, the stabilizing action of those muscles are inhibited. That leads to instability as well. Remember, dancers' breathing is going to change throughout their performance piece due to the demands of the piece. It's important that we can teach diaphragmatic breathing. One hand on the belly, one hand on the chest. You don't want to breathe and let your chest lift up and down. You want to breathe from your belly. That belly breathing is called diaphragmatic breathing. On the exhale, it gives you more support. As your belly goes closer to your spine, you get more support, therefore less instability. Now, you want to use all of these tips in your everyday life. Whether you're bending over to get the laundry out of the washer or putting clothes into the dryer, or to brush your teeth, you can engage those abdominals, those deep stabilizers, avoid contracting those global muscles, and make sure you're breathing from your belly and not from your chest. Stay tuned for more information. If you've ever asked yourself, which is better, Pilates equipment exercises or Pilates mat exercises? Or should I just stand on a wobbly surface and help to work my abdominal muscles? Well, you'll find out. And don't forget to subscribe to my YouTube channel, Kiva Price Pilates.